I was 12 when Ethan was diagnosed with nephrotic syndrome, so I didn't really know everything that was going on. But I saw my parents, struggle to find answers. It's a rare disease, and there's not that much information out there, so we were all looking. It was a hard time because we didn't know necessarily what was going on, but it really helped kind of shape our interest as a family in pursuing answers. I first started my YouTube channel around the same time that Ethan was diagnosed with nephrotic syndrome. I was young, I didn't really know anything about science, so I spent a lot of time trying to understand more about his condition, and then because of that, I kind of just fell in love with the sciences in general, hearing about all the different treatments he had to go through and all the doctor's appointments. I kind of naturally became interested in the medicine of it. I noticed that with Ethan, he didn't really have access to a network of patients or really a lot of information on the condition, especially information that was geared towards his level. So I reached out to NephCure and they provided me with some resources that I helped shape into a number of videos, especially activities that were teaching young kids about their condition using beads and coffee filters and things like that. So that really pushed me to pursue health literacy in general. When I was in undergrad, I received the major entrance scholarship to study at UBC, which was just an incredible experience. It really changed, I think, my entire life. Receiving the donor support really pushed me to continue to make them through university. And now, even in medical school, I've been involved in creating videos for a number of different medical organizations in the city. And I continue to try and pursue this science literacy as well as healthcare literacy piece. I really owe everything to the donors and the sponsors of the scholarships that I won. Without their support, I don't think I would have made the leaps to pursue things like medicine and to take my career all the way that I have. So I'm really grateful.
Seeing what Ella's done in terms of pushing forward health and science literacy has really shown me the positive impact that people can have through advocacy. I really appreciate her for setting that example for me. I spent many years sort of in and out of the hospital, undergoing various treatments. While I was there, I decided to teach myself how to program and also how to build electric circuits. Being a patient required me to do daily urinalysis tests, and I realized that the system where you go and you dip a urinalysis stick and then you look at it to try and figure out if you're relapsing or not was not the most perfect system. That sort of prompted me to start working on the biomedical device to help patients monitor their diseases using urinalysis tests. I first started by developing an albumin urine sensor to sort of aid chronic kidney patients in being able to monitor their conditions, and then moved on to other projects, including a cerebral spinal fluid leakage detector for sort of detecting any spinal trauma in the emergency room. I felt like going to UBC was the right place to learn more about that. I'm really appreciative for all the donors that have helped me and that have helped UBC, because I believe that the donations that they really make an impact.
And it's been really great seeing the devices that he's made, helping patients, take control of their healthcare and get a better understanding of their own symptoms. I'm really proud of him.